Good afternoon, sir. My name is Ramesh Sashi KUMAR. I'm the first year medical student at UniSZA. So today I would like to do some physical examination for you. Is that okay for you?
Yes, okay.
The procedure that I plan to do to my patient are as below. The first one is to ask the background general history of my patient. Then I will do the radial pulse assessment, then followed by respiratory rate assessment. Then I will ask my patient regarding the common symptoms in heart disease. Finally, I will explain about the thalassemia disease to my patient. Now I will ask the background general history of my patient, which include the personal history, history of the presenting symptoms, family history, and social history. Okay, sir, I have few questions for you. Can you answer for that?
Yes.
Okay, first of all, what's your name, please?
My name is Ravi and I'm Lelaki Sashi KUMAR.
Okay, your age, please?
40.
40. Okay, where do you live?
Kuala Selangor.
Okay, Kuala Selangor. Okay, why do you come to hospital?
Come to hospital because of chest pain.
Okay, chest pain. Okay, for how long?
For 1 month.
1 month. Okay, can you describe the chest pain a bit?
It is like short pain and its pain started at chest and radius to left arm, neck and jaw and is relieved by rest.
Okay, so can you rate this pain from 1 to 10?
6.
Okay, thank you. So, okay, I'm going to ask about the family history. Okay, do any of your family members also experiencing this chest pain?
No.
No. Okay, do any of your family members like your father, mother or your grandparents have any heart disease before?
No.
No. Okay, thank you. Okay, can I know your occupation, please?
Working as a clerk.
Clerk. Okay, do you smoke or drink?
Yes.
Okay, thank you. Okay, how often do you exercise in 1 week?
No, I don't do exercise.
Okay, thank you. Now I will do the radial pulse assessment. Firstly, I will sanitize my hand before the procedure. Then I will place my 3 fingers on the wrist of my patient. Then I will apply just enough pressure so that I can feel the beat. Then I will calculate the pulse rate for 1 minute. Then I will repeat it with the both hand so that I can make sure that the beat of the both hand occur at the same time. Can I put my finger on your wrist?
Yes.
Okay, give me your hand, please. Can you give me another hand, please? Do you mind if I raise your hand above your head?
No.
Give me your hand, please. The radial pulse rate of the patient is 85 beats per minute, which is normal. Now I'm going to do the respiratory rate assessment. Firstly, I will ask the patient to sit upright. Then I will try to count the respiratory rate of the patient without his snoring. Because if he knows, he may try to control his breathing and this will lead to the false respiratory rate. I will notice his chest rise and fall. 1 rise and 1 fall are considered as 1 breath. So I will calculate the patient's respiratory rate for 1 minute. Okay, can you sit upright? Okay, just relax. The respiratory rate of the patient is 18 breaths per minute, which is normal. Now I will ask the patient regarding common symptoms in heart disease, which includes chest pain, dyspnea, palpitation, edema, and some systemic symptoms which include fatigue, syncope, night sweats. Okay, so now I'm going to ask you a few questions regarding the symptoms of heart disease lah. So just now you said that you have chest pain. So encik ada sesak nafas tak?
Ada.
Ada. Kalau masa baring tu ada sesak nafas tak?
Ada.
Ada. So biasanya encik guna berapa pillow untuk tidur?
3.
3. Okay. So ada tak masa tidur tengah-tengah tu sesak nafas lepas tu bangun?
Tak ada.
Tak ada. Bahagian badan ada bengkak mana-mana tak?
Tak ada.
Tak ada. Okay, ada tak encik rasa macam jantung tu beat cepat?
Ada.
Ada. Okay. Ada tak macam pening-pening?
Ada.
Ada. Encik rasa letih tak? Cepat rasa letih tak? Ada. Okay. Encik ada gain weight tak?
Tak ada.
Tak ada. Okay. Malam tu ada berpeluh tak? Masa tidur tu? Malam-malam tu?
Ada.
Ada. Okay, itu je. Now I'm going to show the surface anatomy for auscultation for the apex, mitral valve, aortic valve, pulmonary valve, and tricuspid valve. For that, there are some terminologies. This is the sternal angle, okay. Since the first rib is not palpable, we will use the sternal angle as a reference because sternal angle is just adjacent to the second rib. So this is costal cartilage, and then the space between the two ribs we call as intercostal space. This is the clavicle bone. The midline of the clavicle bone we call it as midclavicular line. So the apex of the heart is located at the fifth left intercostal space at midclavicular line, and then the auscultation point also at here. For the aortic valve is located at here, which is third intercostal space at left sternal border, and its auscultation point is at here, which is second right intercostal space just lateral to the sternum. For the mitral valve, it is located at here, which is the fourth costal cartilage left sternal border, and its auscultation point is at here, which is fifth left intercostal space midclavicular line. For the tricuspid valve, it is located at here, which is the fourth intercostal space at mid-sternal. Its auscultation point is at here, which is fifth left intercostal space just lateral to the sternum. For the pulmonary valve, it is located at here, which is third costal cartilage at left sternal border, and its auscultation point is at here, which is the second left intercostal space just lateral to the sternum. Now, I will explain about the thalassemia disease to the patient. Okay, since you have thalassemia disease, so I would like to explain a bit about the thalassemia disease. So the first one, okay, thalassemia is an inherited blood disorder that can cause body to have less amount of hemoglobin than normal. So basically, this hemoglobin will carry oxygen, okay, to your body. If you have less amount of hemoglobin, it will lead to anemia and you will become fatigued easily So basically, this disease, okay, is caused by the mutation in the DNA of the cell that make hemoglobin. So what is mutation? Mutation is just like something wrong in your gene, okay, in your gene. So this mutation basically is carried by from your parents to you So you can't get thalassemia by your own, okay, it's from your parents. And the third one is thalassemia can be classified into two: beta thalassemia and alpha thalassemia. And most common in our country is beta thalassemia, and the most severe one is beta thalassemia major So there are some symptoms and clinical features of thalassemia. So the first one is growth retardation, macam ada masalah pertumbuhan. Lepas tu bone deformities tu, tulang ada masalah pertumbuhan tulang pun ada masalah. So orang yang ada beta thalassemia ni kita panggil muka dia mongoloid face. And liver and spleen will become big enlargement of the liver and spleen. Lepas tu anda akan jadi letih cepat letih. Lepas tu skin dekat sini akan jadi pucat, pale. Lepas tu ada beberapa complication akan ada heart complication, masalah jantung. Lepas tu spontaneous fracture due to thinning of the bone. So bone tu akan jadi nipis, so dia mudah patah And macam mana kita boleh prevent thalassemia ni? The first one is genetic counselling. Macam mana orang yang dah kahwin, dah mengandung, okay, bila isteri tu dah mengandung, kita akan check anak tu ada thalassemia ke tak. Kalau anak tu ada thalassemia, better kita consider abortion. Lagi satu, blood transfusion. So orang yang ada beta thalassemia ni, kita memang tak ada spesifik ubat So kita akan biasanya kita akan bagi blood transfusion, kita akan bagi darah. Lepas tu iron chelasion therapy tu dia macam bila kita bagi banyak darah, okay, akan ada banyak iron, besi dalam badan. So nak keluarkan besi tu kita guna iron chelasion therapy. The last kali tu bone marrow transplantation. So yang paling efektif ialah bone marrow transplantation kita akan ganti. So yang ni akan prevent beta thalassemia ni. So ini adalah beberapa info saya dapat bagi kepada encik mengenai beta thalassemia.
Now I will explain the steps to get the blood sample for the investigation. The process will just involve a small needle inserting into one of the veins of the arm. It might slightly uncomfortable but not painful. So for this process, we will be needing a tourniquet, gauze, blood collection device, alcohol swab, plaster, and sample tubes. Wash your hand first, inspect for a suitable vein, then apply tourniquet, palpate the vein, then wash your hand again. Then wear apron, use gloves, clean the side and allow it to dry. Then anchor the vein from below using your thumb. Insert the needle at the angle of the 30 degree or less. Observe the flashback. Anchor the needle to the patient's skin. Fill the sample bottle, then you need to release the tourniquet. Remove the needle, apply pressure using gauze, Then you need to dispose the sharps appropriately. Apply the plaster. Then you need to remove the glove, apron and dispose all of the clinical waste appropriately. Finally, you need to thank the patient.